guys, sorry that chapter 13 was uploaded so late. I had to re-record the whole thing because I tried to do chapter 13 on my Mac, but it didn't record the screen correctly and it didn't convert. So I'm back on this computer for chapter 13. Some people asked how I got access to the PowerPoints for the class, and what I did was I just googled the title of a certain section. So for example, figure 13.2, the spinal cord and spinal meninges, and I just typed in HCC at the end. And as you can see, some other teachers at HCC has posted the PowerPoint. So I like these because I can see the pictures. I have an older edition of the book, so I just wanted to see if it matched up. Most of the time it does, but I like it to have it in PowerPoint format so I can screenshot it and put it in my notes. Alright, section 13.1. Introduction to the spinal cord, spinal nerves, and spinal reflexes. So we have spinal reflexes. These are our rapid and automatic nerve responses that are triggered by specific stimuli. This is controlled by the spinal cord alone and not the brain. So basically, the reflex is controlled by the spinal cord, and let's say you're frying bacon on a cast iron pan, and then you pick up the cast iron pan and you didn't realize it was sizzling, but before your brain can tell that you are aware of the pain, you've already dropped the pan because of your spinal reflexes. Section 13.2, the spinal cord. It goes over the gross anatomy of the spinal cord. It's about 18 inches long and about ½ an inch wide. It actually ends between vertebra L1 and L2 right here. And this is because when we're a baby, the spinal cord continues to enlarge and elongate until we're about 4 years old. And up to that time, the enlargement of the spinal cord keeps pace with the growth of our vertebral column. So during this time, the ventral and dorsal roots are very short and they enter into the intervertebral foramina, but after age 4, the vertebral column will continue to grow and elongate, but the spinal cord does not. So the result is the dorsal and ventral roots will gradually elongate, and the space where the spinal segment and the vertebral segment corresponds is lost. So that's why for adults, our sacral segments of the spinal cord are at the levels of L1 and L2. Our spinal cord has bilateral symmetry. We have grooves divided from the spinal cord into the left and right. Bilateral means both sides. Posterior median sulcus we have on the posterior side. Anterior median fissure is the deeper groove on the anterior side. How I remember which side is anterior and posterior is I think of a woman's body. So anteriorly she has breasts, and the space in between her breasts are wider than the space in between her butt crack on the posterior end. That's how I remember it. Enlargements of the spinal cord is caused by amount of gray matter in the segment. So this involves sensory and motor nerves of the limbs. The cervical enlargement contains the nerves of the shoulders and upper limbs. The lumbar enlargement, this contains the nerves of the pelvis and lower limbs. So we have the distal end, we have this conus medullaris. This is a thin conical spinal cord that's located just right below the lumbar enlargement. Then we have the filum terminale right here, which literally translates to thin strand. So this is a thin strand of fibrous tissue, and it's at the end of the conus medullaris, and this attaches to the coccygeal ligament. So this helps support our spine longitudinally. And then lastly we have the cauda equina. So cauda means tail, equina means horse. So because the end of our spinal cord kind of looks like a horse tail, they call this the cauda equina. And these are nerve roots extending below the conus medullaris. We have 31 spinal cord segments, and we have 5 spinal spinal cord regions: the cervical, thoracic, lumbar, sacral, and coccygeal. The spinal cord segments are based on the vertebrae where spinal nerves originate. So the positions of the spinal segment and vertebrae changes with age. The cranial nerves, these are named for the vertebra immediately inferior to the name. And this is because the first pair of spinal cord nerves, C1, it passes between the skull and the first cervical vertebra. So this is why the cervical nerves take the name of the vertebra immediately inferior to it. So in other words, the cervical nerve C2 will precede or go before vertebra C2. And this is the same for all the cervical nerves. So even though there are only 7 cervical vertebrae, there are 8 cervical nerves. All the other nerves, they're named for the vertebra that is immediately superior to it. So we have 12 thoracic vertebrae and we have 12 thoracic nerves. We have 2 branches of the spinal nerves. We have the ventral and dorsal root. So here's the ventral root. It contains axons of motor neurons. And the dorsal root, this contains axons of sensory neurons. So how I remember this is to remember same afferent is sensory and motor is efferent. So I remember same, Dave. Same, Dave. So the dorsal root is going to have the afferent division, and that is sensory. The ventral root is going to have the efferent division, and that is motor. So the dorsal root contains axons of sensory neurons. Remember, axons are those long chain structures that are very thin. The dorsal root ganglia, this contains cell bodies of sensory neurons. So D stands for Dave, it's going to have sensory neurons. And remember that they contain cell bodies because if you look at the dorsal root ganglion, there's a bulge right here. And so remember, the cell bodies are round and they're larger than the axons. So there are no cell bodies of motor neurons in our spinal nerves. Each side of the spine, we have the dorsal and ventral roots joined to form a spinal nerve. The spinal nerve, each side of the spine, we have dorsal and ventral roots. They join to form a spinal nerve. Some spinal nerves are mixed nerves, so they carry both sensory, afferent, and efferent motor fibers. Okay, moving down to spinal meninges. These are specialized membranes that isolate the spinal cord from the surroundings. They protect the spinal cord, they carry blood supply, they are continuous with cranial meninges, so they fuse together with the cranial ones. Meningitis is the viral or bacterial infection of the meninges. And meningitis can be dangerous because it can disrupt the normal circulation of cerebrospinal fluid, and they can damage and kill neurons and also damage neuroglia in the affected areas. The 3 meningeal layers, the first outer layer is called the dura mater. It's tough and fibrous, so think dura is durable. Cranially, it fuses with the periosteum of the occipital bone, and it's continuous with the cranial dura mater. Caudally, or on the tail end, it tapers to the dense cord of collagen fibers, and it joins the filum terminal, or the thin strand, and the coccygeal ligament. The dura mater has an epidural space between the spinal dura mater and the walls of the vertebral canal. It has loose connective and adipose tissue, and it's usually used for anesthetic injection site. So this is called usually an epidural block. You can remember epidural Epi means on, and dural is the dural matter space. The second layer is the arachnoid matter. This is the middle meningeal layer. Arachnoid means spider. Arachnoid membrane is made up of simple squamous epithelia, so you know that a lot of diffusion is going to happen in between this epithelium. It covers the arachnoid matter, and we have spaces inside the layers of the arachnoid matter. The first one, we have the subdural space. Sub means below, dural means the dura matter, so below the dura space, and this is between the arachnoid matter and the dura matter. The subarachnoid space, this is below the arachnoid. This is between the arachnoid matter and the pia matter. This contains collagen and elastin fiber network, and they're called arachnoid trabeculae. They kind of look like spider webs, so just remember trabeculae and equals arachnoid spider. It's filled with the cerebrospinal fluid. Remember, this is made by our ependymal cells in the choroid plexus. Cerebrospinal fluid, this carries dissolved gases, nutrients, and wastes. So when someone's getting a lumbar puncture or a spinal tap to withdraw CSF, they're going to puncture through the dura matter and then into the arachnoid matter to get the cerebrospinal fluid. And they are going to want to avoid puncturing the pia matter. If you puncture this matter, problems will happen. The person will get headaches and possible infection. It's a big no-no to puncture this pia matter, which is the inner meningeal layer. This is consists of a mesh of collagen and elastic fibers. This is what adheres to the spinal cord, and it has a lot of blood vessels, and it's bound to underlying neurotissue. Okay, structures of the spinal cord. We have paired denticulate ligaments. This is what they look like. They extend from the pia mater to the dura mater, and they stabilize side-to-side movement. So here you can see the denticulate ligament right here as well. The blood vessels, they are along the surface of the spinal pia mater. So here are the blood vessels. Okay, let's answer some questions. Number one, the spinal cord is part of the central nervous system, C. Also includes the brain. The blank is a strand of fibrous tissue that provides longitudinal support as a component of the coccygeal ligament. That is the thin strand, the filum terminal, where terminal means end. It's going to be at the very end. Number three, spinal nerves are both sensory and motor, C. The spinal cord consists of 5 regions and blank segments. It's going to have 31 segments. The 5 regions are cervical, thoracic, lumbar, sacral, and coccygeal. The dorsal root ganglia mainly contains, the key word here is dorsal root ganglia. So ganglia is bundle of nerves. We're going to remember same Dave. So the sensory are afferent. Dorsal is also afferent, so it's going to be sensory neurons. And because it's a ganglia, which is a bundle of nerves, it's going to have that bulge right here. So that's going to carry the cell bodies of sensory neurons. The ventral root of a spinal nerve, it contains, remember same day, we got ventral, it's going to be efferent, so it's going to be the axons of the motor neurons. The tough fibrous outermost layer of the spinal cord, tough fibrous, think of durable, dura mater. After what age does the vertebral column continue to elongate but the spinal cord does not? It's going to be after age 4. If the dorsal root of a spinal nerve is severed, A, output to skeletal muscles would be blocked. No, because dorsal we have sensory neurons. Output to visceral organs would be blocked. No, the spinal cord would not be able to process information at that level. No, The brain would not be able to communicate with that level of the spinal cord. No, sensory input would be blocked. Yes. The subdural space lies between, sub means under, the dura mater, so it's going to be between the dura mater and the erector. Number 12, the layer of meninges in direct contact with the spinal cord. So that's going to be the innermost layer, which is the pia mater. A dorsal and ventral root of each spinal segment unite to form a, going to be spinal nerve. In meningitis, inflammation of the meninges occur. That's true. Bacteria can be the cause. That's true. Viruses can be the cause. Yes. And CSF flow can be disrupted. Yes. All of the above is correct. Number 15, which of the following is true regarding an epidural block? A, it is commonly used as a method of pain control during labor and delivery. Yes. It affects only the spinal nerves in the immediate area. Yes. It can provide sensory and motor anesthesia depending on the anesthetic selected. Yes. It can provide many sensory anesthesia depending on the anesthesia selected. Yes. All of the above is correct. For 16, cerebrospinal fluid flows within the, answer is B, subarachnoid space. The spinal cord continues to elongate until about age 4. The specialized membranes that surround the spinal cord are termed, these are going to be spinal meninges. The specialized membranes that surround the brain is going to be the cranial meninges. Blood vessels that supply the spinal cord run along the surface of the innermost layer, that's the pia mater. Samples of CSF for diagnostic purposes are normally obtained by placing the tip of a needle in the D subarachnoid space. In the arachnoid matter. In adults, the conus medullaris is found at about, look at the picture. Answer is L1. That's because there's our sacral, lumbar, vertebra ends around there. That's going to be the beginning of our horsetail. Bill contracts a viral disease that destroys cells in the posterior gray horns in his spinal cord. As a result, what will happen? So posterior is the same thing as dorsal. So it's going to affect the axons of these sensory neurons. So the answer is A. Loss of sensation in his torso. The white matter of the spinal cord is mainly, answer is D, myelinated and unmyelinated.